Welcome. My name is Matt Sullivan, and I'm here today to provide awareness on opioid and substance abuse issues facing our communities. I'm part of the UPSOAR grant consisting of Ozarka College, Winrock International, UAMS, and Midsouth Health Systems. UPSOAR stands for Understanding and Preventing Substance and Opioid Abuse in Rurality, and our goal is to educate Izard, Sharp, Fulton, Stone, and Baxter surrounding the ever-growing issue of opioid and substance abuse. Again, my name is Matt Sullivan. I'm part of the team here at Ozarka College. I'm a licensed mental health therapist here in Arkansas. My work over the past several years has led me to see how much our communities could benefit from additional awareness about this debilitating disease. While the nature of today is to present you with information, I encourage anyone to think about any questions they may have. This is a safe environment, and our main goal is to share information in a positive, respectful way. I and other members of our team are willing to speak with anyone who may feel they have any additional questions. Our goal for UPSOAR is to improve quality of life in rural Arkansas by increasing the knowledge and awareness about substance and opioid abuse. Today, we will cover a few different topics, including the disease of addiction, recognizing the signs of misuse and abuse, how we can all reduce the stigma of addiction, and solutions you can take with you into everyday life. The learning objectives for this presentation are to understand how you define addiction and opioid use disorder, understand how you or a loved one can be affected by addiction and opioid use disorder, identify the signs of misuse and abuse, discuss how to combat the stigma of addiction, identify practical resources to help on the road to recovery, and to identify and respond to an opioid overdose. Our first section is going to cover the disease of addiction. What do you think of when you hear the word addiction? Is it a disease centered in the brain? Is it a weakness or moral failing? Or could it be a combination, a brain disease and a moral failing? The answer is addiction is a disease of the brain. Addiction is defined as a chronic dysfunction of the brain system that involves reward, motivation, and memory. It's about the way your body craves a substance or behaviors, especially if it causes a compulsive or obsessive pursuit of a reward and lacks concern over consequences. If you're anything like me, you're probably thinking of addiction as a negative sense right now, but can anyone think of a positive addiction? If you came up with something such as working out or exercise, I think you'd be right. As we go through the rest of today, I encourage you to think outside the box. Think about other behaviors or things that people can become addicted to besides substances, and hopefully this will shed a light on how addiction works. When we engage in activities that induce pleasure, our brain releases a neurotransmitter called dopamine. Activities of pleasure can be eating, drinking, exercising, or abusing substances. Dopamine is a chemical messenger that tells our brain and body that what we enjoyed, we just did. This is an illustration of how dopamine works with everyday pleasure. Dopamine travels throughout the brain's reward pathway. I would like everyone to think back to when they last felt the craving to eat. Do you remember what it felt like after eating a meal when you've been hungry? This is a little bit of dopamine running through your brain, allowing you to feel satisfied. Now let's take a look at how addiction affects the brain. When we add foreign substances and become addicted to them, our brain produces excessive amounts of dopamine traveling around our reward pathway. As you can tell by our illustration, the dopamine is moving faster. There's quite a bit more than when you were hungry in our last slide. Addictive substances hijack our brain into thinking we must have them to survive. When our brain floods with dopamine, our body feels these substances are higher on our brain's priority list and thus creates a system in which we crave these substances more than food, water, shelter, and interactions with others. Our brain becomes trained or hardwired to think and act this way. making it difficult to choose between any other pleasure activity. The good news is our brain has the ability to unwire these connections. This process is called neuroplasticity. Have you ever heard of someone who has lost one of their five senses and felt the other sense improve drastically? This is a small example of neuroplasticity. The brain is forming new connections to make up for what is lost. For addiction, this means if a person who is using substances can find a treatment they feel will work, the brain can form new connections to improve the power of treatment. Now that you have an idea of how the brain works with addiction, you may ask yourself, what factors put me or someone I know at risk for developing an addiction? Three main factors contributing to addiction are psychological, biological, and social. First, psychological factors can include reinforcement, which we can use to feel pleasure, or can be described as a constant exposure to a substance in a home or in public. Co-occurring mental health disorders such as depression, anxiety, bipolar, PTSD, or it could be looking for relief from the symptoms associated with those disorders. Could be difficulty controlling emotions or impulses, and those could be related to a mental disorder or could just be a personality trait. Family history of hot tempers, for example, could lead to drinking to escape anger. Some biological factors include family history, where we have found studies show that 40 to 60% of addictions can be traced in genetics. Gender is also another factor, the biological difference between men and women. Changes to the brain, such as developmental disorders. Last, we look at social factors. These include peer pressure, lack of social support, which we just define as isolation or little to no family and friends, a traumatic past or traumatic family experiences, social acceptance, or significant life changes such as divorce or loss of a job. According to the CDC in 2017, there are a little over 70,000 drug overdose deaths. Of those deaths, about 48,000 were opioid related. A couple of those stats with the fact that in 2017, prescription rates in the U.S. were 58 for every 100 persons. This means, on average, almost 60% of the U.S. population would have a prescription for opioids. From the same CDC report, our stats here in Arkansas for 2017 were about 450 related deaths with a prescription rate of 105 for every 100 persons. This means there are more prescriptions in Arkansas than people. To put that into perspective, Arkansas was double the national average for prescription rate. Another thing to think about, maybe saying to yourself, that's impossible. I've never had a prescription for opioids in my life. What does that mean? I want you to think about that. It could mean people with multiple prescriptions, absolutely. And to me, this is a very staggering stat for us here in Arkansas. The next few slides give us some insight into what our area of the state looks like. Here you can see that Sharp County has the second highest rate of opioid deaths here in Arkansas. As you can see, Izard and Fulton County tie for third highest. And lastly, Baxter County has the highest rating of opioid deaths here in the state of Arkansas as of 2017. This next section will cover opioid use disorder and look at identifying signs. First, what exactly are opioids and how do they work? They can be natural or synthetic chemicals that relieve pain by reducing pain signals sent to the brain. We've given a few examples of popular names such as Oxycontin, Vicodin, and morphine, but other examples are heroin, codeine, tramadol, and fentanyl. Opioids, along with other medications or drugs, involves the level of risk you assume. When taking chemicals that alter the way your brain functions, you run into certain risks. Risk with opioids can include addiction, overdose, or even sudden death. Opioids cause a euphoric feeling, which can lead a person wanting to take more to experience the same feeling. This can lead to physical dependence, your body going through withdrawals unless you ingest more of a substance, or tolerance, which is your body requiring more to experience relief. A good example of tolerance is alcohol. At one point, it may have only taken one drink to feel tipsy. Now it feels as if it takes several to get that same feeling. With opioids, our body works the same way, but with added consequences such as side effects. Our body can get sensitive to pain to alert us we need more relief. Along with the physical side effects, many people can experience mental side effects as well, including depression and anxiety. While we may be targeting opioid risk factors, I hope everyone realizes these risks are associated with most all substances. Alcohol, for example, can elicit the same risks, but they may look different. One last thought for you to consider, knowing what we just covered. Imagine what it's like for people who mix prescriptions or substances. Take, for instance, mixing alcohol and opioids. What do you think the body's reaction to having high levels of both substances in the body and its effect? We touched on the mental side effects caused by opioids, and it may or may not surprise you to know that opioid use disorder is a classification in the DSM, or Diagnostic and Statistical Manual, for mental disorders, just like depression or anxiety. The DSM-5 calls opioid use disorder as the problematic pattern of opioid use leading to problems or distress, including distorted thinking, behaviors, and body functions. Why is that important? Opioid use disorder, just like any other mental disorder, can be a lifelong battle or constant issue. There is no finger snap solution. While there are many forms of treatment, many people will feel they live with this constantly. I would encourage you to think about someone you know, or even yourself, if you have struggled with depression, anxiety, PTSD, or any other mental disorder. Do you think for that person they feel they're truly cured? I don't think so. I think many people go through periods of time where their symptoms are low, but many people live in fear it could pop up at any time. How can you tell the difference between misuse and abuse? Misuse could be described as taking Vicodin for a headache or Xanax to help with nausea. Abuse could involve illegal activity, usually stealing prescriptions or stealing money for substance use, or taking the substance for the euphoric feeling, such as taking it to get high. Other examples of the difference between misuse and abuse are misuse could be taking doses at the wrong time, which is not following the directions on the bottle. Forgetting a dose, we've all experienced the sensation of not taking all the antibiotics. You want to save a few for the next time. Or taking medicine from a friend for a headache or a stomachache. Abuse usually occurs without a prescription, where either you're buying someone else's prescription or stealing prescriptions, taking for the euphoric feeling like we just described, or exceeding the dose, where the bottle says take one a day, but you may take 4, 5, or 6 at a time. Repeated use and developing tolerance. The main difference is the intent when talking about misuse for abuse, according to the FDA. We've reviewed the risks and talked about misuse and abuse, and we'll finish with this section by looking at examples of warning signs. There are 2 sets of warning signs: physical symptoms and behavioral symptoms. For the physical symptoms, you could look at bloodshot or glazed eyes, dilated or constricted pupils, sudden weight changes, both adding or losing, changes in hygiene, such as body odor, dressing differently, not showering, major changes in sleep and appetite, loss of teeth, and skin changes. And this could be coloring of the skin, needle marks, or lesions. Some behavioral warning signs to look at could be increased aggression or irritability, such as a short temper, becoming violent or physical when angry. Changes in attitude or personality. This could be becoming less friendly, hanging out with different friends. Lethargy, which could be sleeping all day or not wanting to be as active as before. Depression. Changes in social network. Changes in habits or priorities. Remember, substances will normally take over all priorities, including money, family, and friends. increased criminal activities such as stealing or just general mischief. It's important to take these warning signs not just at face value, but as a guide. Some people may exhibit these signs due to personality. Aggression and social withdrawals are examples. Depression can be caused by many other factors, not only substance abuse. But we hope you realize that this can be a gradual change. Compare how you notice someone acting today versus 6 months ago. Also, addiction can happen in a legal sense. Imagine going in for surgery and your doctor prescribing pain medication for your recovery. Addiction to opioids can happen in a matter of doses. It doesn't have to take abuse for addiction to occur for some. Our last section covers stigma and addiction. This is the most important part of why we are presenting today, in my opinion. Some of you may have started today thinking, why is this important? Or even, how can I make a difference? Well, this is the area where the most change can be made. We can talk about the science behind addiction, how the brain hijacks our system, what the warning signs are, how to combat warning signs, and even how to respond to an overdose. But the biggest area to make a change is how you interact, talk, communicate, and engage with people with a substance use disorder. The only person who can make a change is the person with the substance use disorder. We can help that decision become easier by showing support instead of shame. We'll start with a few first true-false questions. How many of you think addiction is a choice? Hopefully everyone knows that this is false after learning about the science behind addiction. Substances hijack the brain into thinking it's the only option. Your brain and your body tell you it's a must, just like food and water is a priority. Remember the dopamine slide? Your brain is tricked into thinking it's a necessity. We've had numerous people on previous presentations talk to us about how they feel addiction is a choice. What we hope that you understand is addiction is the first choice, or there is a choice to take a substance the first time. What we're saying here is that after you become addicted, addiction is not a choice. People with a substance use disorder lack self-discipline, which is why they cannot stop using. True or false? Again, this one is false also. Similar to our last slide, our brain tells us we need this substance to survive. Many of you may have been taught, as I have, that if you're strong enough, you can overcome your addiction. This is just simply not true. A person needs unconditional support, family, good friends, and everyone understands this may be something they carry with them the rest of their lives. An example here may be cigarette use. Many people may feel that if they just put down the pack of cigarettes, then they won't be addicted to them anymore. But nicotine is an addictive substance and works just like opioid, marijuana, alcohol. Most people with a substance use disorder have a criminal history. True or false? False. Many people struggle with addiction and their friends, family, and loved ones never know about it. Harmful substances do not discriminate between socioeconomic factors, age, religion, or gender. It can happen to anyone, including you or me. And our last one, drug problems are only in big cities. True or false? Hopefully you all got this one right as well. We touched on a few stats here in north central part of Arkansas earlier. This area of Arkansas is one of the worst affected regions in the state, and I wouldn't consider us to have any big cities. So what is stigma? Public stigma is a negative attitude towards a specific group of people among the general public. The most visible form of stigma we all see today is a negative attitude many people feel towards the police. Relating to opioid use, around 80% of people believe people who are addicted to prescription opioids are the problem or are to blame. and around 70% of people believe they lack self-discipline. In order to help the problem, we need to understand what we contribute to the problem. It can be easy for us to sit back and point fingers, but look at where that gets us. We'll fall into this 80% crowd. So I'd like you to think about what words or phrases come to mind when you hear opioids or substance use disorder. And what can we do? We can start by looking at the way we talk to people and engage with them. The next couple of slides are some good examples of some common language many of us use around people with substance use disorders. I'd like you all to take a minute and read through these. Do any of them stand out? Are there any that you don't agree with? And once again, this is stigmatizing language. These are the words that probably many of us, including me, have used. And these are the words that we should try to stay away from. Addict. Addicted to, just insert your substance. Addicted to marijuana. Addicted to opioids. Addiction. Clean. Opioid replacement. Dirty. Reformed addict. Drug abuser. So if those were the stigmatizing languages, words that we should stay away from, what words or phrases can we use instead? I'd like you all just to take a second and see if you can come up with a few. This slide would show the preferred language that we think would be better words or phrases to use. So instead of an addict, a person with a substance use disorder could be used. Instead of opioid replacement, we could use medication-assisted treatment. Matt has a substance use disorder. Regular substance use. Instead of clean or dirty screen, we could have testing positive for a substance use. Instead of reformed addict, a person in recovery. And instead of addiction, we could have substance use disorder. There are several different forms of stigma we need to look out for. The first is self-stigma. This is the feeling of negative attitude one has about themselves. A good example would be, I use drugs, therefore I am weak. Perceived stigma is what the person thinks others feel about them. Perceived stigma happens commonly with family and friends. People struggling with a substance use disorder may feel the families think less of them. This slide shows that a family member is potentially thinking they seem weak because they have a substance use disorder. Or the person with the addiction is feeling this is what the family member is saying about them. Enacted stigma. This is the feeling a person gets about the actions someone might take against them. The workplace could be a good example. This one here portrays the person feeling they will not get a job since they've been to rehab. Symbolic stigma. Piggybacking on the rehab example, symbolic stigma would be described as a person feeling devalued because of going to rehab. Another example could be a mental institution. Many people feel that if they've been to a mental institution, then they are not stable. The symbol of a place with a negative connotation, such as rehab or mental hospital, is what we're talking about here. So how do we fight our tendencies that have been taught to us? If you're honest with yourself, as I have while working on this project, then maybe you found an area in which to improve. At least that's our hope. Fighting stigma can be done in some small steps. Talk openly with others. Talk openly with people with substance use disorders, and be open and honest with yourself. Don't be afraid to educate yourself about the subject. The more you know, the better understanding you have to help or be helped. Understand the role language plays in overcoming the disease. The way we talk to others has a big impact on the decisions they feel they are empowered to make. Encourage equality between mental and physical illness. Many people around the country and world believe if you can't see it, it doesn't exist. This is very true in regards to mental health. If any of you have experienced issues in the mental health field, it is treated second class to doctors, in my opinion. People tend to believe more of what they see than what they feel. Show compassion and choose to empower others over shaming them. Be open and honest about treatment. If something isn't going to work, then be able to hear others' side, and if it applies to you, speak up when you feel treatment isn't working. Be open about helping others with stigma and helping others to not harbor self-stigma. We've compiled a few ideas to help or solutions that you can take with you. Prevention. Communicate with your doctor. Let them know what works best for you. Be open and honest about your treatment. Ask for safer pain management options, physical therapy, and/or behavioral health services. Take medications as prescribed by your doctor and what is on the label. If you feel your prescriptions are in danger of being taken by someone else, store them in a safe place and dispose of any unused prescriptions. I know around here, most police stations have drop boxes where you can return your medications and have the police department dispose of them in a safe and secure way. Here are some options if you or someone you loved are looking for recovery options. Naloxone is a medication administered to people who are experiencing an overdose, and it counteracts the effects of slowed breathing. Pain management. We discussed being open with your doctor and looking for alternative ways to treat pain. Also remember about neuroplasticity, the brain's ability to rewire itself. By choosing alternative methods by a doctor, your brain will begin to rewire itself to not crave opioids. Peer support. This is a big factor. The more support a person feels from the family and friends, the better chance of success they will have. Remember, support can come in the form of changing the way you communicate with a person with a substance use disorder. Community resources such as AA or NA meetings, and I know some churches offer classes for the public, as well as inpatient and outpatient therapies. Overcoming stigma. This is one of the biggest ways we can all help make a difference. The more we educate ourselves about what we contribute, the more we are becoming part of the solution. Remember, it's easy to pick out the flaws of others and more difficult to see the flaws in ourselves. Understand the role stigma plays in this epidemic and become part of the solution. Finally, we look at some treatment options. Medication-assisted treatment, or MAT, is a form of treatment that uses prescription medication to counter the cravings of opioids. Most commonly used medications are methadone and Suboxone, which are prescribed by a doctor and usually require the client to visit the office once a month. MAT, or MAT, is becoming a popular choice outside of inpatient and outpatient therapy. Like with any form of treatment, it has its upsides and downs. Some concerns I've noticed by talking with clients have been some feel they're trading one opiate for another. When we talked about opioid replacement therapy in our stigmatizing language, this is what we're talking about. These facilities are not located in every city, and the cost can be very high. I worked in one of these facilities, and the cost was around $250 a month cash. Many insurances currently do not cover the visit or the prescription. To counter those concerns, many people I met with talked very highly about the success rate. Many commented on how they were able to stay off opioids while in the program, as well as looking at the overall cost. It was less expensive than their habit. The final form I'd like to touch on is inpatient and outpatient treatment. Like I said at the beginning of our time together, we partner with Midsouth Health Systems. And if you would like any further information on how they can help, reach out to us and we will be happy to provide their information. And I believe they provide both inpatient and outpatient programs for addictions in this service area. I want to thank you for taking the time out of your day to listen to our program. We hope this program has provided you with tools you can take with you into your community.